Good evening. Welcome to another show of Aging with Attitude. I'm your host, Phil Koch, and tonight we have a great guest who's been on the show before, Ms. Twila Adams of Holistic Nail Care Services.
Yes.
Welcome. Welcome, Twila.
Thank you. Thank you, Phil. Thank you.
Why don't you tell us a little bit about your company, Holistic Nail Care Services, and what you've been doing since last February, since our last show.
Well, thank you. Holistic Nail Care Services is a mobile manicuring, pedicuring, and Reiki therapy service that provides mobile manicures and pedicures for seniors, the sick and disabled who are confined to their homes, nursing homes, assisted living, independent living, wherever they are. I travel to them to provide them those services in their home.
Wow.
Yep.
Wow. And how long have you been doing this now?
I've been providing nail care for about 20 years. I started as a kid, spending time with an aunt who had very nice nails. And of course, being a senior, she was my best friend, and I wanted to emulate her. So it's been since I was a kid. I got licensed, went to school and got my license back in '93. Wow. Then again, another license in '95, and then another license in 2005. So a long time.
Holy cow. Now, and you live in the area here in Mecklenburg
Yes,
County?
I was born and raised in Charlotte. Yep.
Okay.
I'm a Charlottean.
And do you provide care in Mecklenburg County, or are there other surrounding counties?
Mecklenburg and surrounding areas.
Okay.
Yeah. I have clients as far away as Salisbury. Going to be going to Tampa this weekend, and one of my clients will also be there.
You're kidding.
And
wow.
She called to make an appointment prior to her leaving for the National Wheelchair Games, which are in Veteran Wheelchair Games, which are in Tampa. Wow. And I don't have time to see her, so my statement to her was, should I bring my kit? Because if I carry my kit, then she can still have her nail care service, even though she lives with MS. So she has some limitations as far as getting out and getting to the salon. But we'll be there, both of us are veterans, and we'll be there for the wheelchair games. And I might take my kid along and do some work on the side of playing sports.
Play sports. So what are you going to do in the wheelchair games? What do you do?
Well, actually, I play 9-ball, which is billiards, air rifles, competition, trap shoot. I bowl. And I play table tennis, archery.
Oh my goodness.
I will be doing participating in a tennis exposition this year. It's not a medaling sport for the games, but I'll be playing wheelchair tennis as well.
Okay. Wow, well, good luck to you.
Thank you.
So tell me, give me an example of a typical call you might get from either an existing or potential client, and then, where you go from there.
My clients are able to find me, as you mentioned, by phone, word of mouth, but I also have a website, holisticnailcareservices.com. Okay. And they go to the website and they're able to click on a button that says Our Services, scroll down, then there's a Book Now button. You click that button and you're able to see my whole schedule. And they make an appointment, and then I get an email or phone alert that that client has made an appointment.
Right.
I give them a call, whether it's a client or the caregiver or hospital or whatever organization, senior living, and we do a phone consultation for the client to find out if it's someone that can receive a service, or do they need a referral to the podiatrist or a doctor.
Right.
And then I map out the dates, times, confirm everything, and I go out and provide the service.
Wow, that's great. Men and women? Men and women,
children, it doesn't matter the age. I specialize in seniors because we find that once they're living in an independent living or assisted living or nursing home environment, they don't receive the type of touch and nurturing only because of the volume of people that are needing care. Usually they're handled or moved in a way that ultimate result is for them to be comfortable.
Right.
But so often they go unserved. And when we neglect to take care of the nails of those people who are in a confined situation, we find that the nails get really long, they pick up bacteria underneath the nail and put their finger in their eye, then they have an eye infection, and it's just a vicious circle after you become old. But I do serve those who are disabled, and there are some children who have health concerns that require my services for Reiki and also for nail and foot care.
Reiki. Tell me more about Reiki and what that involves.
Reiki is a Japanese method of stress release. It's been around since the 1800s. It became popular in our world more so in 1922, late 20s, by Dr. Yeshua, who initially was Buddhist, and he studied all of the religions of the world. And when he found the teachings of the Bible, he realized that this is the purest form of love. His goal was to find out how to initially help people heal themselves. So Reiki is that Japanese method of stress release. It induces relaxation, minimizes stress, and it promotes healing in the body.
Wow.
Yep.
Wow.
Yep.
So do you have to be certified?
You do. You do.
What is that called? Forgive me.
Being certified.
Yeah,
Reiki 1, there's
okay.
Reiki 1, which teaches you to work on yourself, emotional, spiritual, and physical issues, as well as others. Reiki 2 teaches you to provide distant Reiki and to work more on the emotional areas of a person's health.
You mean distant Reiki, meaning what? Out?
The person you could be at home, you could be in another city, another
Okay.
state, and I could still send that distant healing to you at the moment that you're relaxing, so that we can help you get over whatever health concerns that you're dealing with, or ease the health concerns. One thing that Reiki has done and proven to be done is I work with the Reiki group, a lot of practitioners that get together and we learn a little more and practice. Well, I had the opportunity to go to Gastonia to help with people who were dealing with cancer.
Right.
And so after their treatments, they would come into an area and recline in a chair, and for 30 minutes, a group of practitioners like myself would provide them with Reiki energy, which is distributed through the hands, holding the hands over the areas of the body that are out of balance, if you will. And the clients there, their testimony was that they weren't as nauseous, they didn't experience as much fatigue, they were able to relax, they had a euphoric feeling, and they felt better after receiving Reiki.
Really?
Yes.
Wow.
Yes.
So how many clients are you, most of your clients, are they like once a month, or is it once a week, or what's a typical pattern of them seeing you?
Typical pattern is once a month or every other month. Usually for the feet, it's every other month.
Okay.
For the manicures, it's usually once a month. But I do have some clients who've requested my services weekly.
Weekly?
So
wow.
it just depends, yes. I do have some clients, and particularly they were males in the professional arena who always wanted to make sure that they were presentable and that their hands and feet were suited their reputation, if you will.
So somebody told me, I had a friend who was in the shoe business, and he was always saying, I can always tell a lot by somebody by their shoes, and I always looking at their shoes even when I'm not involved.
That's
Do you
right.
find that happening even when you're around, you're looking at people's nails?
Yes. That's the first thing I notice on a person's, their
Really?
hands, their feet, and their shoes. Because your hands and feet, what we call reflexology.
Yeah.
All of the organs in your body are represented in your hands and feet. If your feet hurt, there are going to be other things in your body that are out of alignment.
Right.
You know what happens when you stomp your toe? It'll make you say some words. That's very painful, but that pain goes throughout your body. So through Reiki, reflexology, hand and foot care, through holistic nail care services, I'm able to spend an hour to help that person relieve the pressure and the stress of the pain that they feel through their hands and feet, which initially, of course, affects the whole body.
Yeah.
I've had seniors who I've seen, and their family members will tell me, when we want to try this for mom or dad, but we're not quite sure how they will respond, you know, they don't know you, and I come in, I greet them, I tell them what we're going to do, I keep them informed, and they're usually fine. And the family members in some cases will say, well, how did you talk her into it? I just explained what we were going to do. And they realize that somewhere, for those who have Alzheimer's and dementia, sometimes they remember somewhere they had someone touch their hand and feet and made them feel better.
Yeah.
And then a person who is very unsure, aggravated, irritated about a change from living at home, to a senior environment, providing a nail care service for them could help them relax a little more, because they're going to see me each and every month or every other month. They will see me, and I become their friend or their family member or their daughter, and they begin to relax with me because I am able to spend that time. And it also helps the caregiver too. It gives them an opportunity to get away and spend some time, much needed time, away from the situation that maybe they're dealing with that loved one.
Now, do you find that while you're performing this service, are you also do a little therapy? I mean, do people talk to you about the issues and problems? And
they do, they do. And one thing with my clients who have Alzheimer's, dementia, or memory of Parkinson's, or things of that nature that affect their memory, is they may tell that same story every 10 minutes.
Right. Right.
And I'll listen to that story every 10 minutes, just like I heard it the first time. Instead of being a little more combative and explaining, well, you just told me that. Well, when you say that to someone who's dealing with that type of health concern, they get confused. And they may feel like, well, did I? Or if I did, am I crazy? So let them have that moment. They may be as old as 90 years old. You know, let them have that moment. And because they can communicate with me and tell me those same stories over, they begin to see me as their friend. And they want to talk to me versus talking to family, because the family is so emotionally involved. And it's just hard to see the changes take place as we get older, get into that 80, 90, you know, some of my clients are in that range and feeling those kind of pressures.
I own a home care company, and our caregivers, oftentimes you'll hear clients when we open up the case and they'll say, well, you know, you want them to do this, and we develop a care plan, and the family says, yeah, but my father's never going to do that. Say, well, sometimes a third party can do things that perhaps an immediate family member can't, because there's some family dynamics or history in the past. Do you find that to be the case?
Yes, I do. Yes, I do. An example, I was called to go to a hospice care unit in Concord. Lady sent me the email, then I talked to her, and she goes, my mom's in a coma. You know, she's in hospice, she's in a coma, she can't communicate, but we want her nails done. We feel like this is it. Well, I went up to meet the lady, and when I entered the room, I talked with her as I talked with you. There was no difference to me. I believe she can still hear me. Well, she was going through some breathing issues, the client, who was lying flat in the bed, and the daughter said, let me just push the button and help her sit up a little bit. Well, when she helped her sit up some, it wasn't enough because mom was continuing to cough. And I asked the lady, my client, would you like for her to move the bed up a little bit more? In her fixed position, her head's fixed, her eyes are closed, she said yes. And the daughter looked at me, and I looked at her, and I said, you heard it as if I heard it. I didn't do anything different than you do. What's the different dynamic here that caused her to answer me? And she wanted to know, why did she talk to you? I said, because I asked her a question. You said, I'm going to move the bed up for her. You didn't ask her. Now, the lady did make her transition, but that day, she and I had an experience that was awesome. She had a manicure, she had a pedicure. We took off all the red polish, the pinks, and all the colors that were on there. And she was very relaxed when I left as I touched her. She responded, and I said, you be good, you take care of yourself. And so I have to believe that at that one moment, when I serve my client, no matter who that client is, if it's you, if it's Effie, whoever it is, this may be the only time that I have the opportunity to share Reiki energy of unconditional love for your greatest and highest good. This may be the only time. And so I take each client just that seriously. In fact, sometimes I get nervous when I'm called to serve someone, because I know that this may be it. This may be the last time. So I approach that type of attitude of service. What I do is a service. You can go to a spa, you can have a spa party, but to have a service that is detailed just for you and whatever you need, and wherever your favorite chair is in your home, hospital, or wherever you are, that's what Holistic Nail Care Services does. That's what I do, is make sure that I'm giving the best service as if it's going to be a person's last service.
Right, like very therapeutic.
Yeah.
Really?
Yeah,
right?
it is. That's why it's holistic.
Can you help somebody if they're diabetic, higher levels of diabetic care?
Yes, I do.
Yeah?
Yes,
Okay.
I do. A lot of my clients are diabetic. My mother, for example, has some pre-existing diabetic issues that she's dealing with right now, and I provide her with pedicures, but I suggested that she see the podiatrist just because she needs to see a doctor. I'm looking for certain things, the doctor's looking for other things. Well, she goes in for the podiatric care, and I ask her, Mom, how did that work for you? And she said, oh, it's okay, you just cut them a little too short, but you still have to do them.
Right.
So I still have to do her feet because she enjoys the relaxing portion. She just can take a nap for an hour and regenerate, just reboost, and she's ready to go again. Huh. Yeah. So people do see the podiatrist, and in between time, there are some podiatrists who will say, you can take care of this person for me. Yeah. Because we're not going to go out to the house all the time because they really don't need our care. Yeah. But every 6 months, I want to see them. And then that becomes once a year because of the constant care that they receive from someone like me. I treat all of my clients as if they were diabetics. I treat them as if I'm serving a baby because the skin of a senior or someone who's going through physical trauma, it gets thinner.
Why is that? Why is it? Because I see it a lot with our clients that are older. They're definitely the skin gets more fragile. Is it just because they're older now?
We're getting older.
Yeah.
We just, our body's
more
like an old car. We just wear out.
Yeah.
We just wear out over time. But if we take good care of ourselves, monitor what we eat, good food in, good stuff out, eat to live, not live to eat. Right. Watch our nails because the nails are the mirrors to your inside health. When they start to change, you start to get ridges, you start to get those little hangnail things, something's changing. Sometimes it could just mean that your nails are dry. Yeah. And the only thing we need to do to combat that is we're told when we grow up, put lotion on your hands. What about your nails? Just take the time to actually apply the lotion around the nail and on the nail so that it can have the moisture that it needs to thrive. And the same for the skin.
My mother went to somebody who took care of her nails, and I don't know if, but when they were doing her hand and doing her nails, they noticed something on her skin, which actually turned out to be very important because she went in and got it checked out, and it was the first signs of skin cancer, melanoma. Do you ever see anything like that? I mean, does that ever come up?
I do, the same as you mentioned with that technician noticing that place on Mom's hand. The same applies to my clients. Yeah, I'm always looking. Always looking. Yeah. One of the things that Effie mentioned earlier was some of the things I see in my clients. This is a before and after picture of a gentleman.
Yeah, can we zoom in on that?
Yeah, his feet, his nails needed to definitely be cut. He has a lot of scar tissue underneath his nails, and this is what they look like when they're finished. Wow. And you can see the feet are a little darker down here and a little lighter up here. We gave that guy a foot massage and increased the circulation in his feet, and it perked up the skin on his feet. Of course, we need to make sure that we apply circulation because where there's blood flow, there's growth. And this is another one of my clients whose nails were just a little bit too long. So she was kind of grumpy and uncomfortable. Once we cut them, put her in some nice socks, some comfortable socks and shoes, she was a much happier lady. So these are some of the kind of conditions that I see in my seniors. And Effie also mentioned filing and taking care of the nails. As I mentioned, make sure that they stay moist, just like your skin, so that the skin won't dry out. Make sure that when you're filing a nail, you're not sawing the nail, because when you saw the nail in this manner, the nail splits at the tip.
Really?
Nails grow in layers, just like your skin. So when you saw it, you cause that layer to separate. The goal is to go from one side to the other side. And you think you have to saw because you think this is hard, but you can change the shape of it very easily by sawing from one side to the other, keeping the nails nice and moist and the skin nice and moist, and you shouldn't have a problem. And when we develop these little hangnails on the side, don't pick them, don't pull them because they get infected. Yeah. And people have lost finger digits because of infections in fingers and toes, so we don't want to do that. Just keep it nice and moist. And when you're in the shower, use your towel to just run your hand, run it back over, rub it back over your cuticles, and then all that stuff will exfoliate.
Yes.
And remember to just massage your hands to keep the circulation going, because extremities lose circulation as we get older as well.
Sometimes you'll see women with very long nails. I mean, like they purposely are growing it way long. Is that something that you mentioned earlier that could potentially, I mean, do you recommend that, or what do you suggest? It
Well,
depends.
nail enhancements are what you're speaking of,
Okay.
whether it's a tip, a sculpture, a gel. Some people use nail enhancements just to help their nails look better.
Okay.
And if it's applied properly, done in the right manner, with the client consultation to find out if this is the right service for the client, then I could recommend it, especially if it's done by a licensed professional.
Yeah.
Only a licensed professional could do that. I don't have any problem with the artificial products. Of course, I know how to do it all and I teach it all.
Right.
But my focus is natural nails.
Yeah.
When I look at a person's hair, skin, and I see a lot of artificial product, the hair is healthy, the skin is healthy, then the nails are healthy.
Yeah.
They may just need to, if they choose, to grow out of that product. And some people are in professions that require them to pay closer attention to their appearance and their nails, and they just can't grow nails. They have a problem with it, and they're not willing to wait and do the steps that it takes to help them grow healthier nails. It takes about 6 months to see a change in your nails, hair, and skin. Some people don't want to wait that long.
Yeah.
Some people would rather go in every week or every 2 weeks and have their shellac or gel or whatever they're wearing, you know, touched up, and their enhancements and the color there, and they're happy. Well, my seniors and the people that I serve, we don't focus on enhancement.
Right.
We don't focus on nail polish or bright nail polish, because we need to find out what's going on underneath that polish. I will give them clear, and on occasion they may get something light, some pink or something to that nature, but we want those caregivers and physicians and assisted living and independent living folk to be able to see that nail, because when you start to lose circulation in your hands and feet, the nail tells it all.
Yeah.
Because the blood flow will come back very slowly. You want to be able to examine that in the feet and the hands of those that I serve. So we stick to clear polish. But yeah, we do we learn to do it all. We learn everything there is to know about the body.
Let me ask you, sometimes you'll see a senior and they'll have yellowing nails. And does that usually mean, I mean, is that any type of diet issue? I mean, is that lack of calcium, or what causes the yellowing? Is it just aging process?
It could be just stains, aging process from smoking. When people have stains on their nails, I tell them to soak them in white vinegar for a little while, rinse them off, wipe the white vinegar off, put some clear nail polish on them for about 7 days, and the nails will get a little stronger. The white vinegar, lemon juice, people use lemon juice. That will help remove the stains. I have one person who likes to use Clorox, and I suggested that he not use Clorox because I'm not sure how that's going to affect his skin. But our seniors usually have that thickening, dark nail just because along the way they may have picked up some bacteria, or stomped the toe, or stomped the nail, or hit it in a way that's caused that nail to become deformed.
Yeah. So what would, you know, not to go in too much into detail, but what's a typical cost for a nail service that's done by
that
your
I
company?
provide? My mobile service is $30 for the hands, $40 for the feet.
Okay, that's reasonable. Yeah.
And if we go over a 100-mile radius or go a certain distance over 10 miles, then there's an additional fee. But basically, it's $30 for the hands, $40 for the feet, and $65 for the hour Reiki therapy session.
Reiki. Oh, you got me thinking about Reiki now.
Good. That's good. It will definitely help you relax.
Well, tell me, I'm going to mispronounce this. Onyxologist?
Onyxologist.
There we go.
That's the technical name for a manicurist.
Okay, all right.
Onyx meaning hard substance representing the nail, and ology meaning the science of nails.
Yeah.
So we learn all about the diseases and disorders of the hands and feet. We learn about the histology, the bone structure, the whole body, because what we put on or in our body is going to affect the way the body responds.
Huh.
Yeah.
Is it true, well, I'm asking, is our nails they're just hardened dead skin, right?
Yeah, basically. Yeah? Basically, yes. That's it. And we're only required to, our bodies only require us to have a nail long enough to reach the tip of our finger to prevent diseases and bacteria from getting in.
Wow.
That's what it's designed for.
And how long did you have to go into school to become an onyxologist? And then how long was training as part of that process?
To become an onyxologist, you need 300 hours in school. Now you can do that.
300 hours?
Yes, and then go and take the state exams, North Carolina State Board exams.
Okay.
And then I went back to school for my teacher's license, so that took another 300 and some hours.
Holy cow.
And then go back and take another state exam.
So there's probably not that many onyxologists in Charlotte.
Well, there are tons of
yeah.
manicurists.
Okay.
Yeah, we're just manicurists, and some of us choose to use that title, Onyxologist, because we stay on the technical side of the diseases and disorders of hands and feet.
Yeah.
Yeah.
So, but you serve seniors, obviously, and the sick and disabled. Do you do anybody that would require your services?
Yes, I can.
Yeah. And do usually are the seniors, are they calling you up, or is it more spouses or sons and daughters that say, I think my mother might need some help?
The whole gamut.
The whole gamut.
The whole gamut.
Okay.
Because my website, Holistic Nail Care Services, is there, I hear from people in Iowa, people from Canada, all over. It's the World Wide Web.
Really?
So I get requests from people all over, people I've never met before.
What's the farthest place somebody's asked for service?
I think Iowa.
Iowa?
Yeah.
They weren't going to fly you out there.
Well, they had a loved one who was living here.
Oh, gotcha.
Who moved here.
Yeah.
Found me on the website and said, hey, I have a friend who moved there with his family. I was serving him as a Reiki master and practitioner. I looked you up on it. Can you serve he and his family? And I said, yes.
Wow.
It's that simple. I love it.
Yeah, that's cool. Now, and you're a vet too, right?
I am. I am a disabled vet.
It's probably has helped you with regards to talking to other vets. Have you served vets in your profession?
Yes, definitely. Disabled vets.
Yeah.
Served 11 years in the military, and a lot of that training and the war and all of that training has helped me in my business now.
Oh, that's fantastic. Well, it's going to be exciting. You're going to have to tell us on your next time here all about your trip down to Tampa. And
wheelchair games,
the
and
wheelchair
San Diego
games. That's very
tennis
exciting.
camp. Yeah, I'm aging with attitude. I'll be 55 in December, and I'm excited to participate in the senior games this year.
That's fantastic.
Yep, having a ball.
Well, I want to thank you, Twila, again
you.
for coming on the show.
Yeah.
We have Twila Adams has been our guest tonight with Holistic Nail Care Services.
That's correct.
And please keep an eye out for those who are anywhere near Tampa. She'll be in some of the games down in Tampa. So I want to thank you very much again for coming on the show and explaining to me and educating myself and all the viewers tonight more about nail care services.
Thank you so much.
Thank you very much.
Thank you.